Hi, I'm Dr. Sorin. I'm an anesthesiologist and board certified pain specialist as well. Today I want to talk about vertebral compression fractures. These are fractures that occur in the spine. Typically, these occur in people who have osteoporosis, which oftentimes occurs as we get older and our bones thin. They can also occur in people who have been on steroids for long periods of time and their bones get thinned out. So typically what ends up happening is the vertebrae collapses on itself, so the vertebrae shrinks down. Now, if you'll notice on the side here, this is where the nerves exit, and there's also the facet joint on the back here, so you can see when the vertebrae collapses, it can either squeeze the nerves and squeeze the joints and cause a lot of pain. Now, typically, if the pain is relatively mild to moderate and not that bad, it'll be treated with anti-inflammatory medications and rest, bracing, possibly. But if the pain is severe, there's an option of vertebroplasty or vertebral augmentation, even known as kyphoplasty, that we're able to perform. Now, before you get there, there's one of three imaging studies that you need. The best one is to get an MRI with what's called stir imaging, which shows us how much fluid is in the vertebrae, and so it would show us if it's an acute fracture, meaning if the fracture has just occurred or if it's an old fracture. Oftentimes we'll find an old fracture on there that's already healed. But if it's an acute fracture, so you either get an MRI with the stir imaging, or you can have before and after x-rays where you clearly show this is how tall it was before and this is how tall it's afterwards, so you know that somewhere in there there's been a compression fracture. Or you can do a bone scan that will show you inflammation of the bone. So those are the three options there. So if we decide that you're a good candidate for a vertebral augmentation procedure, what we do is bring you into the procedure room and have you lay flat on your stomach. And then we identify using x-ray guidance the exact level of the fracture. And then from there, we place a needle into the vertebral body through what's called the pedicle. So we put a needle into the bone here. And then in the kyphoplasty procedure, we actually try to restore height. So once we have the bone in there, we have a very specialized balloon that's inserted through the needle that we inflate very slowly and carefully and try to restore the height back of the vertebrae. So that's nice. So if this nerve was getting squeezed and the vertebrae was getting scrunched down, we can actually restore some of the height in there. From there, once we inflate the balloon and get as much height back as we feel is safe, from there we can inject some cement, some special bone cement that goes into the actual vertebrae. What's beautiful about that is that the cement hardens within just a few minutes, and you can feel it. I can feel it as the doing the procedure. The bone hardens, so then you know that bone is hardened. So this procedure is very rewarding in that sometimes you'll see somebody come in severe pain, hunched over, not very happy, and then they walk out saying, hey, my pain is much better, my pain is minimal. So from that standpoint, it's a very rewarding procedure to do. Typically, we have three goals in doing these procedures. Number one is to reduce the pain from the fracture. Bone fractures and vertebral fractures can be very painful. Number two is to restore height. And number three would be to improve the integrity of the vertebrae. So now it's actually stronger than it was before. These procedures are very rewarding to perform because people, if their pain is caused by the vertebral compression fracture, they get better. For instance, one patient we had come in, she had been out of work for months, miserable, in pain. We did the procedure, and 2 weeks later she was back at work and as happy as could be. So these procedures are very effective. Obviously, there's other causes of pain that can cause back pain. So just because somebody has a vertebral compression fracture doesn't necessarily mean that's a source of pain. So if you think you have some of the symptoms, please either contact our office or talk to your medical provider about getting treatment for this. Thank you for watching. Stay tuned, like, give us a thumbs up, subscribe, and we'll see you on the next video.